This tutorial is on browser navigation, Ocular Exam Room. This tutorial covers how to navigate the Ocular Exam Room. In the Ocular Exam Room, we see the exam section, and here we're going to be able to perform an exam, document data reviewed, or view and import previous. Beneath that, we have the diagnoses. The next column to the right are findings, which will provide a list of findings once a diagnosis is selected. We see glyphs and special plans. To the right, we see search plans, popular plans, and the plans list. Popular plans and plans will populate once a diagnosis has been selected. To the right, we see the diagram of the external eyes. The follow-up section will never be used by your practice. The E&M expert will provide information about the visit once you begin documenting. As we document the information for the visit, we will be able to scroll down within the Ocular Exam Room and review the progress note. Here you'll be able to see the chief complaint once documented. You'll be able to review the clipboard information. You'll be able to review vital information if documented, as well as the review of systems. And the impression and plan area will start listing all the diagnoses and plans that have been documented, and you'll have the ability to reorder those diagnoses if needed for billing. The Save Visit button is very important. It is imperative that you click on the Save Visit before leaving the exam room. If you do not save your visit, you could be subject to losing information that you've documented. The icons across the bottom of the screen are the same as the top. The Vision Exam will allow us to go back to the Vision Exam section. We also see the iLog, which is another way to access the iLog history. Emma Photos, again, is another way for us to view the photos that have been taken with the iPad. Create Auto Letter allows us to create a referral letter for a provider from the Ocular Exam Room, and we can also use protocols. There is a separate tutorial that will discuss and cover the protocols. It's very important that you get completely comfortable with documenting in the Ocular Exam Room before you begin using protocols. Protocols will allow you to customize specific exam types. In the exam section, I'm going to select Perform Exam, and this is going to take us to an exam set list. The eye exam set should be the one you use for most of your exams. It's not recommended to use the other exam tabs, as eventually these will go away. So here I'm going to select the eye exam, and the very first section that we're going to see is the External tab. There are several tabs across the top of the screen. Each section has documentation denoted with an asterisk. Those sections are also checked for both eyes. This is going to contribute towards your billing points. Each section will also show normal statements for both eyes, and that is the default. If we look at the conjunctiva, the cornea, the anterior chamber lens, and the disc section, as well as the fundus, all of these have the normal statements defaulted. Defer is going to be used to document a reason for the patient declining dilation. If you're billing for gonioscopy, you will need to go to the Gonio tab and check the gonioscopy box in order for billing to be generated. The Miscellaneous tab defaults the normal statements with asterisks for billing, and this is also going to default the normal statements for the disposition and orientation of your patient. The filters will give you the ability to turn off certain areas of this exam set. If you're only examining one eye, you would turn off the filter for the eye that you're not examining. So if you're not dilating the patient today, you would turn dilation off. The same applies for the fundus, the discs, and the slit lamp. If you are doing a dilated exam, using this exam set automatically defaults to dilated. CD ratios must be documented within the Discs tab. This is the only place in Eyefinity EHR you document CD ratios. Once you document the CD ratios for the right eye, use the Copy to OS to copy to the left. At the bottom of the Discs section, you can also document which lens you used. This is also a sticky field, and it will adapt to the logged-in user and default for every patient. When finished, select Done. The eye exam is now highlighted under the Exam section. If we scroll down to the progress note, we are now going to be able to see all of our exam details. The diagnoses list will adapt to each logged-in user. Once you start documenting in the ocular exam room, you will have your top list of commonly documented diagnoses. This list will not be yours initially, but will start generating as you begin documenting. If you are looking for a specific diagnosis and you cannot find it, you can use the Find Diagnosis to search for a diagnosis by name or by ICD-9. So if I type in myopia, it's going to provide me a list of diagnoses with myopia. There's also 4 buttons within the Diagnoses section. There's DDX, which is Differential Diagnosis. Associate Diagnosis will highlight in blue if a diagnosis is selected that needs additional documentation for ICD-10. This is not required. However, you can select and pick additional items. So for example, if you had an impression of type 2 diabetes and you needed to associate that this patient uses insulin, you would be able to select that from here. The button will give you options, but again, it's not required. Status and New Diagnosis will give you the classification of the code. Is it a brand new diagnosis you're documenting, or have you documented this diagnosis in the past for the patient and you want to document the status? Is it stable? Is it worsening? Is it an existing diagnosis with a new problem? It is recommended that you use status or new with each impression. They're not required, however, they will help toward your billing code. Above Findings, you will from time to time see an ICD-10 expert box, and it will be highlighted in blue. So for example, if I select the diagnosis of blepharitis on the left, notice the ICD-10 expert appears. It will default at unspecified. It is extremely important for ICD-10 coding that you not leave that ICD-10 expert at unspecified. You need to make sure that you select the staging for that diagnosis. This findings list populated for blepharitis, and this is one way of documenting your findings or observations for the specific diagnosis code. The glyphs are actually drawing tools and are covered in a separate tutorial. Over on the right, you have popular plans and plans. Once your diagnosis is selected, the Plans tab will provide a specific list according to that diagnosis. You'll also have the ability to create a popular plan list. So again, the ocular exam room will adapt to each logged-in user and will remember your top plans that you use with each impression. You can also search for a plan here at the top under Search Plans. The follow-up section you'll never use. You will always document your follow-ups as a plan within that diagnosis. The diagram on the right is going to be used to select the location of your diagnosis code, as well as some of the plans that you use. The E&M Expert, when you hover over it, it will provide a breakdown of the billing elements that have been documented for coding. Here we're seeing the history information that we've documented, as well as the exam elements that have been documented so far. The progress note at the bottom shows the diagnosis codes and plans once you've documented them here. Scrolling to the bottom of the exam room is going to allow you to monitor your progress you've documented for the patient. You will have the ability to edit or remove anything you've documented here in the exam room. Thank you for listening. We hope you found this tutorial useful. Please visit our support community to view additional tutorials.